Hello, hello. My name is Liz. This is my name sign Liz, and I am making this movie right now. Why? Because I am a graduate student. This is my first week of school. Yay! I'm so excited. So for my first homework, what I have to do is I have to put down a list of like different words that are related to public health. So my idea was I was thinking I'll make this movie, film this movie, and I'll post it up on YouTube for like if other people like deaf or hard of hearing students wanted to become involved in public health, go to graduate school, then they could look at this list and understand these 25 words, these vocabulary words. So here I am providing this for you. These are 25 words related to public health. Here we go. Okay, so I have this list of 25 words and an additional 5 more like bonus words for you guys. Okay, the first group of words, we have 4 words. This group are public health organizations. I have 4 on the list. The first one is CDC. What does that mean? That's the Centers for Disease Control. It's an important organization here in the United States that's related to public health. And really, there's a related word that's WHO. That means the World Health Organization for the whole world. That's like the CDC here in America, but they're over the whole world. We have the WHO. That's a really good for those 2 organizations to work together, coordinate together. Next one is CMS. What's that? That's the Center for Medicare and Medicaid Services. Those 2 are really important to know the difference between those 2. Medicare tends to be for people who are older people. That's a government health care program for older people like retired or disabled people. Like people who have SSDI, SSI tend to be disabled people having Medicare. A different one, Medicaid, that means for like people who are lower income. People might be more poor, would be people who are receiving Medicaid. But those 2 programs, they coordinate together, and their controlling organization is called CMS, that's Center for Medicare and Medicaid Services. That's that organization. So the next one on the list is called FDA. That means Food and Drug Organization. Food and Drug Organization. That controls rules here in the United States related to food, laws, drug, medication, laws, that kind of thing. Oh! I made a mistake. I made a spelling mistake. I need to tell you guys. FDA. What does that mean? Food and Drug Administration. That's Food and Drug Administration. I'm sorry. That was a mistake I made in spelling. I'm sorry. I had to put that in there. Okay, so next. NIH. Ooh, one of my favorites. I love that. NIH. The NIH website has so many things, so much information, like medical research studies and papers you can read through. The research related to different medical issues I really enjoy that. That's really important for like university research. You can read through really, I love that. NIH, very important. National Institute for Health, NIH, that one. Okay, next on the list, the next group on the list, what is it? This is called Public Health Central Core Functions. Public Health Core Functions. There are 3 on that list. We have 3. The first one, assessment. The next one, policy development. And next, assurance. Those 3 together are called public health core functions. These 3. What does that mean? The first one here, assessment. What does that mean? That's like figuring out what the problem is. So you have to observe some kind of health problem, see what's happening, analyze it, figure out what's the problem there. That is called assessment. Next one, policy development. That's the second core function. The second one is called policy development, and that means now that I understand the problem, what am I going to do now? How do I fix the problem? That part is called policy development. The third one, assurance. That means now I've analyzed, I figured out the problem and did the policy development. I know how to take care of it. And now I have to continue fixing the problem. How do I say? Like, there's a government policy that was set up as part of policy development. Now we need to have the police enforcing the law. That could be one kind of assurance. Okay, the next group of terms, now we have the next group of terms. Oh, this is really important. Social determinants of health. That is social determinants of health. That means reasons why maybe people have difficulty getting access to health care. So there are 5 of those, 5 different areas involved in that term. So we have these 5. The first one is economic stability. That means people, do they have enough money? Do they have a job? Are they able to earn money? That's economic stability. That's the first word related to that subject. The next one is educational access and quality. That means, can you go to school? Can you get a free and appropriate public education? That is related to educational access and quality. The third one on the list is health care access and quality. That means, can you go see a doctor? Do you have insurance? Do you have enough insurance that you can afford to pay for a doctor, to go see a nurse, to get care? Can you do that? The fourth thing on the list is neighborhood and built environment. Do you have a home? Do you have a house to live in? Do you have a place to live? That's neighborhood and built environment, that one. Now the fifth one on the list is social and community context. Whoa, okay, social and community context. What does that mean? That means you have social support. Do you have enough social support? Those altogether are the 5 different reasons people might have a tough time accessing healthcare. Public health is really interested in wanting to know how people can address those challenges and access healthcare. So, okay, next, one of my favorite things. I love math. Okay, I just took a class, statistics, just last semester. Oh man, I really enjoyed that class. So the first word on this group, there's 12 words. There's 12 words here related to statistics and statistical analysis. So the first word here in this group of words is statistics. What does that mean? That's when you have information and you want to condense it so that people can read it and understand it. That's what statistics is. Really, it's a special kind of math. Help people understand data, condense data better. All right, next word. Oh, this is a good word. This is confidence interval. Confidence interval. That means a numerical range, and I can be confident in it. What does that mean? Oh my gosh, what does that mean? I don't understand that. Okay, I'll explain it for you. I'll give you an example. So, suppose I tell you, well, this year we have a presidential election happening, and I want to know who is going to win. Well, I'm going to tell you, it's September right now, so we haven't had our election yet. We're all looking to see who's going to win. So doing a statistical analysis, I might take a poll and look at the data from that poll and look to see what are the numbers going to say. My poll says that Trump is going to win. So I'm looking at these 2 different options. Now I'm not going to tell you who I prefer. No, I'm not going to tell you that. I'm just telling you. This is an example. So in my example, Trump will win. Now I've got my mind made up here. I think I've been successful in my results. I think my statistics are right. Wait, are you confident? are you really confident that that's right? Well, maybe. I don't know. Let me think. For example, Trump, in my example, Trump will win. He has, let's see, 52%. Okay. You're confident that that's true? 52%? Are you sure? You're absolutely sure? Well, I'm confident that the interval is going to be, let's see, let me analyze. 95% confident that my number 52 is right. Between 51 to 53%, between that interval of numbers, I'm 95% confident that that number is right. Between 51 to 53%. That's my confidence interval when I'm 95% confident in that. It's confusing. I know it's confusing. Okay, next word is rate. Rate. What does that mean? How often does something happen? For an example, I'm looking at a group that has 30 people in that group. 30 people in that group. I'm looking at their hair color to see what their hair color is. 30 people in the group. And there are 5 people with blonde hair. And that's what I see. That's the information. 5 people in that group of 30 have blonde hair. Okay, so that's the rate that I put down. The rate that I put down, 5 in 30. 5 in 30, that's the rate. How many are in that group? You need to have 2 numbers. That's important. You have to have 2 numbers because you're counting. Oh, I count how many people have blonde hair. There are 5 people. Okay. No, that's great. But 5 in what? 5 in 100? 5 in 6? What? 5 in 30. That's a rate. All right, next word. Crude rate. Crude. That means, crude rate. That means, am I confident in that rate? Maybe not. Maybe that crude rate means that I have not yet analyzed that number. I've just gotten that number. I got the count. Yay, I found out 5 people have blonde hair. I counted 5 people. But maybe I didn't notice that in that group, 6 people are in one family. Oh, okay. So are all 5 of those blonde people in that same family? Maybe, is that a good way to count when I take that observation? I don't know. So, crude. Crude means that I have not yet adjusted the data for maybe mistakes. 2 kinds of possible mistakes. The first one is called an artifact. That's one kind of mistake that could be there, an artifact. The other kind of mistake is called confounding variable. Those are the 2 kinds, artifact and confounding variable. Whew, that's tough to spell. So those are the 2 things. The first one, artifact, what does that one mean? That means, for example, like every day I weigh myself. Every day, and I see the numbers, 150, okay, 149, okay, 150, okay, 151, okay, and then 350, and then 151. And I look at that data, 350? That's gotta be wrong. Why would my phone put down 350? I don't weigh 350. And now I ask my computer, please, give me a graph and show me that information. And I see this graph with this one outlier way up there. What? That's got to be wrong. That's an artifact. That means maybe one number, one response is a mistake. And maybe I read through and I see something that's wrong, something in the data doesn't match. That just isn't right. That's going to be an artifact in the data. Now, the other kind of mistake is confounding variable. Now, what that means, I'll give you an example. I'll tell you. We have a study and we're analyzing and we're looking at people who tend to die from the flu. Okay, all right. So often people tend to die from the flu tend to be older. Okay, so I'm looking at this information. Did they die because of the flu or did they die because they're old? That could be a confounding variable. That means I need to analyze it more to see maybe my data needs to be adjusted because I need to be careful and look at if the data might be confused because of that variable. All right, so next up, the next word is small numbers. Small numbers, what is that? This term is small numbers. That means you have an analysis with a number less than 20 people let me be more specific. I'll explain a little bit more. So we'll have an example. In a study, you have 100 people who in that 100 people has the flu. There's 15 people who have the flu. Can I study that? Just 15 people with the flu? Maybe I want more people for my study. Maybe I want more because 15 people, I don't know, that's not enough. It's not enough. I can't study it very well. So, can I study? Of course I can. I can study it, but that data from that study, would that be good data? Maybe not. So when I see that small numbers tends to mean people in the study with that disease, for example, with that disease are 20 or less. So if I have 100 people in the study with just 15 people who have the flu, I see that, I think maybe I want to increase my study numbers. Maybe I'll put 200 people in the study, and then I'll get 30 people in that new group who have the flu. Oh, that's better. That's better for my study to have 30 people compared with just 15. I don't know. I don't like that. I prefer this group that has 200 people altogether and 30 of those people have the flu. That would be better for a study. That would be better. I would prefer to have more than 20 people. All right, next up, next word. Next word is trend. Trend. What does that mean? Like for example, in the weather, this is 2024, and the temperature tends to be about, 82. This is Florida, I don't know, okay, just for example. So Florida tends to have a temperature of 82 degrees. Last year, maybe the temperature was 81. Okay, all right, 2 years ago, tend to be a temperature about 81. Okay, that's fine. 3 years ago, they had a temperature maybe about 80. Oh, you notice, what did you notice? Over time, it's increasing. That's a trend. That increasing is a trend. Can be an increase, could be a decrease, either way. That could be a trend. That means over time, the information data keeps adjusting in the same direction. It can't be changing one way, changing back the other, changing one way, changing back the other. Nope. It has to be changing continuously one way. That would be a trend. All right, next vocabulary word is validity. That's important. Validity. What does that mean? So for my study, I noticed I have a group of 100 people and 15 people with the flu. I noticed that in my study. Another person has a study. They notice they have 50 people with the flu. You're looking at those two different studies. Are they both valid? When you compare, it should be about the same, but it's very different. You need to analyze, why is it so different? Maybe one of them's not valid. One of them's not a valid number. It's something wrong. That's important. You have to be able to check other people's research and see if it matches or if it's skewed in some way and figure out why it's different. Why would it be different? That check is called validity. Okay, next term. Weighted average. Weighted average. Weighted average. Weighted average. What does that mean? Okay. One example. Weighted average. For age. Weighted for age. I have two groups. In this group, it's older. And we have, 50 people with the flu. This group is younger. We have 15 people with the flu. Oh, I noticed that when I look at these two different groups, maybe when I do my analysis of my data, I'm looking at these two different groups and I notice that change. I want to be able to compare the groups well, make sure that that it's valid. But I have to consider that factor that I might need to adjust that average a little bit related to the ages of the two different groups in those two different situations. Okay, next. YPLL. YPLL. What does that mean? That means years of potential life lost. That means, for example, myself in the future, maybe I will live until age 75. I would tend about to live to age 75. But if I become sick with cancer or something, maybe now I anticipate living to just 65, that's all. Maybe just to age 65, that's all. So that would mean YPLL is 10 years that I don't get to live. I don't get to live to 75. Why? Because I'm sick with that cancer. Oh, yeah. That's just for example. Okay, next up. Oh, yay! Bonus words, 5 more from the NIH. Oh, that's my favorite website. Yay! That's funny. Okay. The first one, clinical research. Clinical research. What does that mean? That means scientific information, we want that research to connect back to healthcare. Scientific research, connecting that research back to healthcare. I look at that scientific information, I analyze that information, everything that they've documented, and I take it back here to my healthcare practice, relate that information back to be able to improve healthcare goals. All right, next term. This is different. Clinical trial. Oh, that's a specific kind of research, a clinical trial. That means you have living people involved in that research. For example, I have a vaccine trial, a vaccine shot trial for COVID. Okay, so I want to try out this vaccine to see how people respond to the vaccine. So I'm giving the vaccine to a bunch of different people. Let's say 1,000 different people get that shot, and then I observe them. I watch them to see, are they healthy? Do they become sick with COVID? Yes or no? Did they become sick with something else? Did they get a temperature? Do they have a cough? Something? I don't know. So I'm watching that, and that's a clinical trial with living people involved in the research. Yeah. All right, next term. Oh, this is an important one. Endemic. I don't know that word. I know epidemic. Yeah, sure. I know that word. Epidemic. That means you have a bunch of people who are sick in the same place at the same time. Like, okay, again, the flu. I don't know, for example. Yeah, the flu. The flu. In this school, in this town, there's the flu all over. That could be an epidemic. Compared with pandemic, I see that word. Oh, I know what I think. I think COVID. Pandemic. Okay. Pandemic, that means all over the world. really, well, maybe not the full world, but like North America and South America, that whole area, that is sick, that's going to be a pandemic. That means a bigger area. Oh, I forgot that word, the important word. Okay, endemic. What does that mean? Endemic. That means always there. Always there. Like, for example, Africa has malaria just all over the place. All over the place. It's always there. It's always there. Malaria. That means it's endemic to Africa. That. Another example, one more example, because I live here in Florida. So I just recently learned that here in Florida, leprosy, the disease leprosy here in Florida is really here, always here, all the time, leprosy. I just learned that here in Florida, always here. So it's called an endemic. It's called endemic to Florida. Okay, etiology. Etiology. What does that mean? That means from where? I have the flu. Where did I get that flu? Where did I become sick? That's etiology. That's called etiology. I want to know where it came from. Where did it come from? All right. Oh, very important. Infection compared with the word disease. Those are two different words. Are they the same? No. Infection, that means you have a germ, you have bacteria inside you, and that's an infection. You're infected with that. But I'm not sick yet. I don't feel sick. I don't have a cough. I don't have a fever. Not yet. No, I don't feel sick. That means I have an infection, yes, but disease? No, not yet. In the future, will I become sick? Will I feel sick? Maybe. Maybe yeah. Maybe yeah. But maybe no. Sometimes no, you never feel sick with an infection. You have an infection inside you, but you never feel sick. That's possible. That can happen. Also is important, can you have two different kinds of disease? Yeah, that's true. This is more complicated, but there are two different kinds of disease. The first one is infectious disease. That means you become sick from bacteria, virus, something like that. That's the first kind. The second kind is like diabetes. Like, what? Diabetes is from an infection? I become sick with diabetes because I have an infection? No. It develops inside you, from yourself. That kind of a disease, it is a disease, yes, but an infectious disease? No, it's not. It's different. Another example of a disease that's not infectious, not an infectious disease, would be heart disease, coronary heart disease. That's another example. Okay, last term. Oh, okay, nosocomial infection. Again, nosocomial infection. What does that mean? That's from a hospital. You got sick from a hospital. You became sick in the hospital. It often happens, MRSA, that's a skin infection that happens in the hospital that can happen. That's called MRSA. Now, it tends to happen more in the community too, but back 20 years ago, back when I became a nurse, that was nosocomial infection only. What's another one that happens in the hospital? What's that called? VRE. That's stomach ache, you have vomiting, different kinds of, it's called vancomycin resistant enterococcus. That VRE, that is one kind of disease you can become sick with in the hospital. I went into the hospital because I already had VRE? No. I'm in the hospital because I have the flu. That's all. Now I became more sick in the hospital because the other people are sick. And I was in the hospital, and so they gave me more disease. It's terrible. Well, that's called nosocomial infection. That's also called hospital-acquired infection, hospital-acquired infection. Those are different names for the same thing. Okay, so thank you for watching me. Thank you. I love you. My name is Liz, signed like this, Liz. I am a graduate student in public health, and I want to share my homework with all of you. Suppose maybe you're interested in working with public health. I want to inform all of you about my experiences, tell you all about my homework. That might be able to help you with your class. Maybe you're a Gallaudet student. I used to be in Gallaudet, class of 2003. I did not graduate. Don't tell anybody. But I want to inform you guys all about this vocabulary list that might be helpful to you guys. Thank you. I love you. I'm sorry, my ASL is maybe not good. I am hard of hearing. I grew up hearing with English in a mainstream classroom, so I tend to sign more PSE. Anyway, I'm sorry about that. I love you. Thank you. Thank you for watching. I love you. Bye.